Move to the next slide. We can get started. Can we move to the next slide, please? Thank you. Okay, welcome everybody, and
Merci,
thank you so much
bienvenue à
for
tous.
joining
Merci tellement d'être présents.
the Emergency Preparedness and
La,
Response
pré-
Review
la
of MISP
préparation,
Readiness Assessment
la revue
Insights
de
and Dialogues on
Emergency
MRA
Preparedness
Implementation.
Review va être faite maintenant, elle va être enregistrée.
This is the second webinar in the
C'est
EPR
le
series.
second webinaire dans la
Just a
série
reminder
IBR.
that this
Vous
webinar
rappelez
is being
que
recorded,
oh,
and
on
there
est en
will
train
be future.
d'enregistrer.
Oh, we can't see your screen, and we're also hearing French on the English channel, says the chat. Okay, perfect. Now we can see the screen, but we are hearing the French right after. Okay, hopefully it should be fixed now. And yes, as noted on the screen, you can see if you need to navigate to the French channel, please go to the interpretation. If you don't see it on the bottom of your screen, it would be under the More category, and hit the little globe for interpretation, and you can choose between the English and French channel. Again, this webinar will be recorded and slides will be available after from the different partner websites. And please, as we go through the presentation, feel free to insert your questions into the chat. And if we have time at the end, we can discuss those as well. Next slide. Okay, so I am going to introduce Nazreen Talbi. She is the Global Emergency Preparedness and Response Consultant for FP 2030 and has over 15 years of experience at global, regional, and national levels on SRH in emergencies and the need for strong preparedness strategies as key to resilience building. She leads the FP 2030 global EPR work and has extensive knowledge and experience on the MISP readiness assessment, and she was one of the lead authors on the tool. Now she's going to provide a quick overview of the MISP Readiness Assessment, and then she will be in charge of hosting a Q&A with different panelists to speak on this topic from different country experiences. Nazreen?
Thank you. Thank you very much, Sarah. Thank you for all the participants to this webinar.
Merci beaucoup, merci à tous les participants.
Actually welcoming our esteemed panelists. Please let me just briefly provide a global overview of what the MISP Readiness Assessment is, how it is structured, and what it aims to achieve. And then we will have the opportunity to learn from experiences in 3 different regions. Slide, please. So, as you know, this webinar series focuses on the importance of preparedness and why actually preparedness is really needed. And the risk of having to deal with an emergency is very much present in all regions of the world, and vulnerabilities are everywhere. And this has also been recently confirmed with COVID-19. So one is really the vulnerability and risk that countries overall are facing. Climate change, the effect of natural hazards, conflicts and pandemics disproportionately affect women and girls and exacerbate actually existing chronic vulnerabilities. Many countries are particularly prone to some form of crisis and often to many simultaneous crises. So in addition, as well, many of these countries face protracted situations or are in fragile settings. So in such contexts, it is really important to know about the magnitude of SRH needs in emergencies. So during emergencies, protection services, protection and service delivery mechanisms such as health, education, and police can be disrupted. Community support systems and protection mechanisms may collapse, but SRH needs continue and may even increase. For instance, pregnant women risk life-threatening complication without access to delivery and emergency obstetric care services. Women and girls may also lose access to family planning services, putting them at risk of unintended pregnancies in unsafe conditions. And they become also more vulnerable to sexual violence, exploitation, and HIV infection. Statistics show that it is estimated that of any crisis-affected population, 25% will be of reproductive age. At any time, 4% of any displaced or disaster-affected population will be pregnant, and 15% of those will experience pregnancy-related complications. So it's also known that 2/3 of preventable maternal death and 45% of newborn death take actually place in countries that are affected by recent conflict, natural disasters, or both. So the impacts of natural disasters, climate change, conflict, and infectious disease outbreaks on health and societal well-being will really depend on how well countries and communities prepare for, respond to, and recover from these emergencies. Slide, please. So before digging into the MISP readiness assessment, we thought it would be important just to set the scene for what the MISP is. So to know what it means to respond to SRH needs during emergencies, there is an internationally recognized minimum gold standard for SRH care during emergencies, which is called the MISP. The MISP stands for the Minimum Initial Service Package for Sexual and Reproductive Health in Crisis. For those of you that are less familiar with the MISP, it is a collection of life-saving minimum actions to be implemented at the onset of a crisis, when more comprehensive services cannot be secured. So it's really a bare minimum. But ideally, more comprehensive services should be continued. It can be implemented without an in-depth assessment and should be available at the onset of any crisis. And it is, as I said at the beginning, an international standard. So the MISP includes 6 objectives that are really designed to prevent and manage the consequences of sexual violence, prevent excess maternal and newborn morbidity and mortality, reduce HIV transmission and transmission of other STIs, and also prevent unintended pregnancies. And the idea is really to plan for comprehensive reproductive health services in the early days and weeks of an emergency. Next slide, please. So now let's look at for the MISP readiness assessment. So it's really given every country's vulnerability to some form of crisis, preparedness for SRH is essential. So what the MISP readiness assessment focuses on is to see what does it really mean to be MISP ready? How do we know if a country is ready to implement the MISP during an emergency? Do we know if a country is prepared? And what is already existing at the country level in terms of SRH and disaster response management, and what capacities are actually missing? We know that starting initiatives, building capacity, assessing existing capacities need to be done prior to any emergency, because often once there is a crisis, there is chaos and limited time actually to conduct these type of assessments. Slide, please. So the MISP readiness assessment helps actually get an understanding and an overview of what the current preparedness situation is at the national or subnational level, and help assess if a country or region is ready to implement the MISP in case of an emergency. And that's any type of emergency. It really uses an all-hazard approach. It has really to be seen as a process. So this is just a starting point, conducting a MISP readiness assessment. And it is a process that helps provide this kind of snapshot of where we are at this given time and initiates structured work around SRH preparedness. So it really has to be seen as something that initiates SRH preparedness work. It really calls for it's a multi-stakeholder process and calls for the involvement of different organizations and entities by involving the governments, civil society organizations, UN agencies, community-based organizations, etc. Next slide, please. So as I said, it provides an overview of what your current preparedness situation is during stable times, because it looks at what is existing during stable times that can potentially be scaled up during emergencies. If we see that during stable times there are already gaps, the chances that it will be scaled up or continue during emergency are really low. So what the MISP readiness assessment is, it looks a bit an overview to get an overview of what is the policy environment, what are the coordination mechanisms that are already in place, what data is being collected and available, what resources are available, financial but also human resources, and how are these services around SRH being delivered. So it really helps to identify gaps and strengths. It also helps prioritize activities helps formulate recommendations, and it can also help articulate advocacy asks. Next slide, please. So as I said, the MISP readiness assessment is really a process, and it includes 3 major steps. One is really the completion of a questionnaire. It has a total of 58 questions that looking at all these different elements that I mentioned before to help identify what the strengths and weaknesses are and really understand what is the current context. The second step is a prioritized action plan. So it's really doing a prioritization exercise based on the gaps that have been identified and developing a joint action plans with the partners that are taking place that are participating in that process to look at what are the priority activities that we need to put in place in order to be able to strengthen emergency preparedness. And finally, it's really the implementation of that action plan. So after having assessed, prioritized, it's implementing a joint action plan that is really targeted to strengthening emergency preparedness for SRH. Next slide, please. I will just provide very briefly, and I'm not going into details here, but so the MRA questionnaire is structured into 2 big sections. One is looking at the overall readiness with regards to the policy environment, coordination, data, and resources. And then you have a second section which looks at specific MISP-related services. And as I said before, it's really looking at the services, how are services being delivered during stable times, and can these be scaled up or continued during emergencies? Next slide, please. So now what we would like to use the opportunity of this webinar to really hear about some country experiences. And I'm actually very pleased to facilitate three fireside chats actually with some very esteemed panelists. Next slide, please. Where we will be able actually to learn from 3 different contexts. We will start with the experience in Eastern Europe and Central Asia. Then we will hear from experience in East and Southern Africa. And finally, a country experience from Nigeria. So in advance, I already thank our 3 esteemed panelists to be here with us today. So let me start with the experience in Eastern Europe and Central Asia. We have today Dr. Luna Marion Moraine. I'm very happy to have you here with us. So she's part of the UNFPA humanitarian team in the Eastern Europe and Central Asia Regional Office, where she is the regional SRH in emergency specialist, and she's based in Istanbul. So Luna is a medical doctor specialized in obstetrics, gynecology with a master's degree in sexual and reproductive health research from the London School of Hygiene and Tropical Medicine. She has over 20 years of professional experience in reproductive, maternal, neonatal, child adolescent health, and has supported country teams across Africa, Asia, South America, and the MENA region. So very large experience. Very happy to have you with us, Luna. So I wanted to start asking you, so your region, Eastern Europe and Central Asia, conducted actually 3 MISP readiness assessments, one in 2014, one in 2017, and one in 2021. Since this very first implementation, can you tell us how the MISP readiness assessment actually contributed to broader health system strengthening to ensure that SRH services are available during both stable times and during emergency? Thank you.
Perfect. Thank you so much, Nesrin, for this introduction, and thank you for having me on this. Yes, it's quite, as you highlighted, the Eastern Europe, Central Asia region was the first region where the MISP readiness assessment was conducted. And it's kind of interesting to go back into the history, like why did it evolve from here? And as you obviously know very well, so there was initially this idea of this is a strong region and we don't really need much to do in order to focus on SRH and emergencies or do anything in preparedness, because our countries have actually quite advanced and stable health systems also taking care of SRH. So a mapping was conducted in 2012. To assess if all preparedness was conducted, and it showed that, wait, is there any question with my language? It was asking me something. I just continue, you let me know.
I can hear you just fine, actually.
Zooms. Perfect. So in this mapping, it actually showed that there was not fully the understanding of why SRH in emergencies was actually needed, especially from the onset of an emergency. So this is when the MISP readiness assessment tool was developed, and in 2014, the first assessment was conducted. And since then, it was every 4 years an assessment. So we have already concluded 3, the last one in 2021, and we're actually planning the next one for 2025. So coming to your question of what happened throughout these years, it's that we could see overall strengthening of like the needs of SRH in emergencies. We could see that there's a quite strong normative framework right now in the last the assessment in 2021, which was not there in the first one in 2014. So huge improvements in stakeholder engagement, in coordination systems, and bringing really all stakeholders together and understanding we need to do something right now, but also in capacity building as part of preparedness, understanding that we need to do ideally capacity building before the onset of a crisis so we can pull resources quickly when needed. However, it also showed that there's still some challenges, and as you outlined as well, there's like the areas of data collection is continuously challenging. This is still one of the weaker ones. Resource mobilization is challenging, and in a current resource restrained environment, this is definitely not improving right now. And we do face challenges with supply availability, and a lot of these discussions about the needs and the usefulness of prepositioning versus like the supply availability in the onset of a crisis. And I want to just highlight the Eastern Europe, Central Asian region. My office, we are covering 17 countries. Most of the countries are quite small. If you're comparing them to other regions, our countries, several countries have like 1 to 3 or 5 million people. So when I'm referring to prepositioning of supplies, we have the risk of supply fragmentation if we preposition in each country. But then if something happens, countries don't often have the resources available by themselves nothing was prepositioned. So that in general, I think we saw overall a huge progress in SRH and emergency understanding, in preparedness, and yet there's some work to be done still.
Yeah, no, that's really interesting. And it's interesting to hear from your region, actually, where it started from. And you pioneered, actually, the work around the MISP readiness assessment. I forgot to say it during my presentation, but the MISP readiness assessments since then have been conducted in many, many different countries. So some of the countries, so you said that at the beginning you have a quite strong region, but actually some of the countries in your region have experienced emergencies or crises recently. I mean, we all know about Ukraine. There was the refugee route that was used through the Balkan route in 2016. But then also a lot of your countries are faced actually with regularly having to deal with disasters. So do you see that the fact that these countries conducted MISP readiness assessment, did that contribute somehow to improve SRH delivery when the shock occurred? And did countries, from your experience, see a difference compared to previous emergencies as far as when looking at speed of delivery or quality of MISP interventions when MISP preparedness was more invested into and prioritized?
Yeah, this is a very interesting question. And I think it's also, again, important to see we're talking about 17 countries with unique backgrounds and histories and threats and risks. Before the Ukraine war, there was not as much understanding or feeling in the region of like a need for being prepared. There were several countries that felt they needed to be prepared, but then after the outbreak of the war, it's now much more imminent everywhere that emergency preparedness is needed. Looking then, what did the MISP readiness assessment contribute to a better, stronger response? It's not easy to attribute this. So some countries said they couldn't see any attribution to a response. Several of the countries had migration movements, and they said, like, look, it didn't really contribute anything to what we experienced. Some countries said that actually the Ministry of Health did not feel strongly ownership of the MISP readiness assessment, the action plan, and then the follow-up of implementation. But we also have some impressive, stellar feedback. So I really, as you mentioned already, in the Ukraine, they actually say that it helped them to implement and make sure that the MISP objectives are addressed on national level as well as on subnational level. So with the MISP readiness assessment, they said this has helped them to train and sensitize everybody across the country before the outbreak of the war. And they're actually using now the action plan that supports the response in the for the Ukraine emergency areas, the war areas. A very positive and highly a great response came from the Armenia office. You will know that there was like 100,000 people came from Karabakh region. They had to leave Azerbaijan and they came as refugees into Armenia. And our Armenia country office said they were the MISP readiness assessment helped them hugely in making sure the staff had the needed capacity trainings ahead of time. There was supplies had been pre-positioned, and the collaboration with partners already was engaged and was already ongoing before the crisis occurred. So yes, it did have quite some impact on the crisis responses as well. Next to, let me say, general preparedness, like in Kazakhstan, it was highlighted that actually the MISP Readiness Assessment 21 helped to develop the advocacy and policy papers already. So we never know when anything can happen, but the assessment helps to really integrate the outcomes into some countries' policies and documents. Yeah.
Thank you. No, this is really interesting, and it's when we look at the MISP readiness assessment, that this is also a process. It's also being able to identify actually these little elements that help actually improve. And we know that improving all of it takes a bit more time, and that there is still a lot of advocacy needed. So we know that one of the outcomes of the MISP readiness assessment is the development of these prioritized action plans to improve SRH preparedness. I was wondering, are you tracking the implementation of these action plans? And do countries measure or evaluate whether the MRA make actually a difference? We know that impact evaluations is complex. We know that people often prefer assessing than implementing action plans, but it would be interesting to hear from your region that went through 3 of these assessments. And maybe you can answer at the same time to one of the questions in the chat, which was about if the assessment covered all the countries or subset of countries. Thank you.
Yeah, perfect. So first to the question, so it did, let me say at one time or another, all countries were assessed, but not every country, every round. So like the last round, the war in the Ukraine already took place, so they did not do the MISP readiness assessment in 2021, but they did it in 14 and 17. And so all countries, and let's be also clear in the terminology, also there's like a territory that is not registered as a country. Kosovo is a territory. They also conducted the MISP readiness assessment according to the time. Just here as a footnote, as a feedback from the country or the territory team in Kosovo, the language was not really always the right one to address their territory needs because they're not considered a state or country. So some things like this sometimes kept us away from actually conducting MISP readiness assessments or having action plans. And I think that's also important to highlight here that in general, countries were asked to develop conjointly with all stakeholders to develop an action plan and then monitor, as you said. Like there was the European IWAC meetings before that also you attended. And during these IWAC meetings, there was an annual check on the progress of implementation. Since the IWAC, the regional IWACs not take place anymore, it's been a bit less centralized or less encouraged to actually do the follow-up of action plans. Most of our country teams are eager still to follow up on action plans, and most do this once, like some do it once per year in a broader stakeholder environment. Some just do it monthly within UNFPA and then try to address and approach stakeholders as need. There was also some feedback. Some countries actually developed action plans that they were never approved by the ministries. And also that is one of the challenges. We need stakeholder and governmental buy-in into action plans. They should be part of developing this as well, but then also taking the ownership of implementation. And we need funding. That has been highlighted as one of the biggest gaps as well. So as I'm looking into like planning the 2025 MISP readiness assessment, I also ask our country teams, like, do we stay as it is, or how do we want to go and move forward? And let me say the overall trend was we should stay with the current approach, how we have done it for 3 times already. So data becomes comparable and we can also see progress, and then maybe make some refinements on the elements of continuous engagement of stakeholders and ownership of the MISP readiness assessment and implementation plan by stakeholders. And then the funding gap, we need to figure out how we can maybe bring in funding into our annual budgeting plans for us in UNFPA, but also for other stakeholders, maybe that we can inspire that everybody can chip in to also do joint implementation of preparedness activities. Good.
Thank you so much, Luna. I think these were very amazing insights, and I think that a lot of countries can actually learn from your region. Very exciting to hear that there will be another round of the MISP readiness assessments, and so we are really looking forward to seeing these results and that to continue learning actually from your experience. Thank you so much, Luna, for all these insights, and let me now move. I would like to invite now Dr. Michael Ebele to hear about the experience in East and Southern Africa. So Michael is a public health expert, researcher, and advocate with significant experience in global health and humanitarian preparedness and response interventions. He currently works for UNFPA as regional humanitarian advisor for East and Southern Africa, where he has worked closely with other team members to support 23 countries to strengthen humanitarian preparedness for sexual and reproductive health and gender-based violence needs in the face of conflict, climate change, and disease outbreaks and pandemics. So, Michael, your region actually, which has 23 countries, if I'm not mistaken, conducted MISP readiness assessments as a regional initiative in 22 of the countries in 2022. So can you share a bit with us what were, this was the first time for sub-Saharan African region to do it as a regional initiative. And so can you share a bit with us what were the main regional trends that came out of this assessment? And have the MISP readiness assessments, as they were conducted in your region, actually contributed to improved government understanding of the critical role of SRH, but also getting some buy-in from a broader set of stakeholders? If you could share that experience.
Yeah, thank you, Nesrine, and thank you, colleagues, for having me this afternoon. So I have already been introduced by Nesrine. So maybe I'll just give a brief background as to how we got into the MISP readiness assessment in the East and Southern Africa region. As you are aware, the region as it is in terms of UNFPA regional configuration consists of 23 countries, right from Ethiopia all the way down to South Africa. So we are impacted by conflict, climate change, disease outbreaks, and of course, we're also not spared by the COVID-19 pandemic. And what is unique also is that, you know, we have a number of crises that are quite protracted in the region, especially the conflict crises that get protracted and therefore strain systems, but also that the region is a mix of, you know, lower middle income countries, upper middle income countries, and also, you know, the other countries that are really on the development trend. So the health systems strength are quite differentiated across the region. So we thought in the background of all this, it would be really important for us to look into how ready we are to deliver the minimum initial service package during emergencies, which seem to be cutting across all countries in the region. So we did that in 2022, and we're able to cover 22 out of 23 countries. So I think the most immediate benefit that we've seen, you know, there's a better understanding of the impact of all these crises, all these hazards on, you know, the delivery of the minimum initial service package, or let's call it sexual and reproductive health, including family planning, and then the understanding of the importance of ensuring there's the continuity of these services, even when an emergency strikes, that, you know, much as the emergencies disrupt the services, but it is important that we continue to address the continuity of these services so that we are able to protect some of the gains that were made in some of the critical indicators like, the rates of maternal death in the countries. So that has really come out as an increased understanding, and that is evident if you went to most of the coordination platforms, humanitarian coordination platforms, which are quite many in the region. When you speak about sexual and reproductive health in emergencies, it's not something that people are looking up to you and wondering what you're speaking. So for us, that was a major shift that we saw. And the other one, there's been a progressive shift at the policy and the strategic level across the countries in terms of the integration of sexual and reproductive health and family planning into the disaster preparedness and response policies, frameworks, but also crisis-specific appeals. This was not the case before. Before, when a crisis struck, of course, the focus was usually, on the most immediate, what were then termed life-saving interventions around food security, water and sanitation, communicable diseases. But we have seen that quite different right now. If you look in some of the countries, for example, some of the countries have gone steps further. For example, in Kenya today, the discussions are actually around, the development of a national guideline on MISP, a Kenyan guideline on MISP, as one of the policy documents one of the guideline documents from the Ministry of Health. If you in Zambia, addressing the recent drought, again, you will find SRH and GBV spoken up in the drought response plans that we talk about there. If you went in Uganda, some of the districts in Uganda, for example, that is at the sub-national level, have actually integrated this into their district development plans, and as such, they're able to quickly tap into that. When they're developing their annual plans, there is already something that in terms of disaster response and preparedness, you are looking at issues around sexual and reproductive health and emergencies. Of course, we have also noted, because one of the things we do also, we've been doing after action reviews, because many of the crises that happen in the region take on a multi-country perspective. If you look at the cyclones in the Indian Ocean belt, they normally affect a range of countries. If you look at the drought, it affects a range of countries. So it has given us an opportunity to evaluate how the response has been. So we have seen significant improvements in terms of the timeliness of the response, in terms of the availability of supplies during the response, because again, after the MISP Preparedness assessment, each of those countries developed a MISP Preparedness action plan, which actually informed the development of most of the disaster response plans to those specific hazards that came up. So we've seen a progressive improvement in terms of the effectiveness and timeliness of the response. We have also seen, because again, under the MISP Preparedness assessment, we had some discussions around some issues like, comprehensive abortion care. Of course, we know that the legal framework in the country is in the region is quite differentiated around that. So we had that in countries where, the legal framework was okay for us to engage in those discussions. We have seen that there's something that they have quickly picked up, again, recognizing that, unsafe abortions are one of the leading causes of maternal death. And the other thing also is we have seen an increased allocation of humanitarian funding, towards SRH and SRH services. If you look at the allocations of the SAF allocations, the country-based pooled fund allocations, and also allocations by some of the member states to the response, we have seen an increasing allocation towards sexual and reproductive health as a result of some of the discussions we had in the MISP Preparedness assessment, because it was an all-inclusive process involving the governments, involving the partners, and in many places also involving the affected communities. Yeah, I'll stop there for now.
No, I think there are so many super interesting things that actually happened and emerged from the MISP Preparedness assessment in your region, because and I think that one of the interesting elements is also around this policy landscape, where we have seen a lot of countries that have integrated or are in the process of integrating SRH into disaster risk management related policies. So I think that this is really extremely interesting. Can you share? So I know that you are taking this work forward. So now we are like in this post MISP readiness assessment phase. And so I was looking, I was interested in learning a bit more. How are you actually building on these results to really continue and keep the momentum around that actually? And are you seeing any major challenges that are still remaining in your region?
Yeah, thank you, Nesreen. So in terms of taking forward this work, we have decided to take advantage of some of the, like I mentioned in my intervention before, that some of the hazards really take on a multi-country perspective, and we do have incidences when when regions are launching their appeals. For example, in the recent El Nino impact in Southern Africa, the Southern African Development Community, that SADC, launched an appeal. It launched an appeal as a region for the response to that. So because of the work that we're able to do with the governments and partners in the MISP readiness assessment and the ongoing discussions around the implementation of the action plans, we're able to actively contribute to the development of that regional appeal that was led by the member states, led by the regional economic entity. So that also helped us to amplify that voice to the donors, but most importantly to the member states, that, because when the member states develop an appeal, it is imperative on them to, to show what contribution they have made before they place it before the donors. So again, some of the donors were coming back and asking what were actually the member state contributions towards sexual and reproductive health in emergencies as they put in resources into this. We have also, as a result of this, we also recognize that the region is too wide, and in terms of capacity building of the frontline service providers, that we're always strained in terms of being able to deliver this capacity building. So countries have progressively built a pool of trainers, and what we are seeing now is the availability of the trainers in one country moving from one country to support another country. Just for example, in the last 2 weeks, we had trainers from Kenya going to Lesotho to support Lesotho to develop the capacity. So it's also one way of us building, that south-to-south learning and cooperation and exchange of best practices. And as a result of the MISP readiness assessment, also it helps us ignite the discussion around, the availability of supplies, because supplies remain one of the challenge. So we had been having discussions around pre-positioning of supplies for a long time, both internally as agencies, as UNFPA, but also the member states or the countries that actually doing some pre-positioning, especially those countries that face, disasters like cyclones and flooding. So again, that has helped us to build a case for, in those pre-positioning schemes, how do we ensure that, SRH supplies are part of, the essential commodities lists that will be put into place in those either regional or country level pre-positioning schemes, either by the governments or by the agencies themselves, be it UN agencies or NGOs, or even the local health systems themselves, actually ensuring that there are supplies that, are in one way or the other pre-positioned for emergencies. In terms of challenges, and then, or before I go to the challenges, also the other area that we found was that the member states are actually keen around, their disaster risk reduction strategies, there are a lot of disaster risk reduction frameworks and strategies. So again, we thought that was a very good entry point. Whenever a country is reviewing its disaster risk reduction strategy, we move in and be able to be part of that process, and we can therefore influence and ensure that SRH issues are captured in that disaster risk reduction strategy, or in some cases, even laws that are being developed around disaster risk reduction and focusing on with the focus especially around climate change adaptation and response. In terms of the challenges, data, like Luna mentioned before, remains a challenge. Again, there's differentiated levels of data collection, and without data, it's very difficult to build evidence for advocacy. So it's one area that we're keenly working on with the countries to support them to ensure that we improve on data collection, but even where data collection is okay, we improve on data utilization. And then, of course, there's a differentiated level of involvement of especially the governments. In some countries, actually, there's greater involvement at the subnational level, which is not surprising because, again, sometimes the disasters really impact people at the subnational level. So you find that there's greater interest at the subnational level, but resources are allocated at central level. So connecting those dots remains one of the challenges that we also find in some of the countries, that there is interest among the people who face the impact, but then the policy and the decision makers need to be brought on board. And then lastly, of course, I mentioned this already, the issue of supplies is really one that we have to continue navigating and to see how we address it. Thank you.
Thank you. Thank you. Thank you so much, Michael. I think that these are all very interesting and valuable points. And I think that what you also mentioned about identifying the right entry points is really key. And what we have seen in your region is that you did manage to get closer to the disaster management authorities and also looking at climate change and elements like that. So I think we could spend hours discussing on that more. But thank you very much for giving us some of your insight. And data is one of the key elements. And yeah, hopefully we will be able to tackle this a bit more in the future. So thank you for sharing all of this with us, Matthew. I'm moving now to our last panelists. And actually, so I'm very pleased to welcome Dr. Matthew Onoja. I hope I did that correctly. I said your name correctly. And I know you, Dr. Matthew, but so you are the humanitarian and SRH analyst in Nigeria, where he contributed actually in ensuring the delivery of life-saving integrated SRH and GBV interventions for conflict-affected individuals in the Northeast humanitarian response. Dr. Matthew is a humanitarian and development expert with vast experience in managing and delivering the full package of sexual and reproductive health and rights and gender-based violence prevention, risk mitigation, and response intervention. Thank you so much for being here with us today, because I know that you are very, very busy. So in Nigeria, you recently conducted a MISP readiness assessment, actually last year. Can you tell us a bit more about what were the main achievements of conducting such an exercise in Nigeria? And also, did this contribute to improve government understanding of the critical role of FP and SRH, and also get a buy-in from the stakeholders? Thank you.
Thank you very much, Nesreen. Good afternoon, everyone in the webinar. I'm happy to be part of this. Yes, to answer the question, we actually did conduct the MISP readiness assessment in 2023. One of the main achievements of that study was the fact that it was the first most comprehensive assessment of SRH for that identified gaps in key areas. And it was quite comprehensive, looking at different areas: policy, environment, human resources, service availability, SRH supplies, as well as data. And so that for us was a key achievement, and we saw that in the level of interest that came out of it during the validation meeting. Also, that assessment created a high level of awareness on the minimum initial service package itself and the need for a national implementation framework to be established for MISP. With the MRA, it became clear that even though Nigeria has been implementing MISP, the implementation of MISP was better known in the Northeast humanitarian response. And then we also know that despite the Northeast, there are many parts of the country that are grappling with different humanitarian emergencies. Some of them from flood disasters, some from communal clashes. We also had some that came about from armed banditry, as well as herders farmers conflict in Nigeria. And in all of these situations, there are displacement of persons that the MISP will be useful in implementation. But it took doing a mirror at the MRA for us to get a clear picture that it was mostly in the Northeast. And also, lastly, one of the key achievements is the fact that it also opened room for further discussion and also to forge renewed partnerships in areas that discussions can be held in order to really implement the recommendations, which was quite good. For example, IRC is a key SRH partner in Nigeria. And from the MRA results, IRC was motivated to open discussion with the Federal Ministry of Health in order to discuss and agree on how to strengthen the Federal Ministry of Health to deliver on its SRH commitments. So clearly that was quite useful. And in terms of the improving government's understanding of the critical role of FP and reproductive health and their buy-in, yes, indeed, the mirror results paved way for a broad stakeholders discussion. And this discussion was led by the Director of Reproductive Health Division of the Federal Ministry of Health. The UNFPA deputy representative had met personally with her before the MRA assessment started and got introduced it to her and told her the need for leadership by the Federal Ministry of Health. And she rose to the occasion and she made sure they were part of all the discussions and not just being there, they actually led the discussions. The validation meeting had a topmost representation from the Federal Ministry of Health. And the meeting also had other participants from government agencies, both at the federal level, at the state level, and then there were INGOs, CSOs, who found the findings quite comprehensive and useful and expressed their readiness to partner more in addressing the gaps. We also saw, lastly, in terms of government's understanding, we saw that the results, after they were released, led to moves by some state governments to contribute funds for local procurement of FP commodities. States like Adamawa and Sokoto State, for instance, are notable. Nigeria has 36 states and the Federal Capital Territory making 37. And so we have Adamawa State, Sokoto State actually looking at this and trying to contribute to the local procurement of FP commodities, which added some value. And then there are ongoing discussions in this regard by some other states that has not yet materialized, but was stimulated by the results of the MISP, of the MRA, sorry.
Thank you, Dr. Matthew. I think that these are, it's really interesting to see how in Nigeria, actually, yeah, as you said, it helped the process in itself, had to create new partnerships or get traction actually from different government representatives to allocate either funding or to invest more time or activities in ensuring better SRH preparedness and providing stronger responses. So we know that in Nigeria, you recently implemented a flood response, and I think you might even still be partially in that response. So I was wondering, even though the MISP readiness assessment is very recent, did the results of the MRA help you respond in a more efficient way? From your experience, do you see that it had a bit of an impact on the response that you had to implement now recently?
Yeah, thank you, Nesrine. That's a very, very important question, especially like you said, the flood, Nigeria is most recent in Nigeria, and the response is still on. Yes, MRA actually did contribute in a way to assisting the flood response, especially in Borno State, which is the epicenter of the Boko Haram insurgency in Nigeria. But I think for the flood, what really supported Borno State the most was the existence of a pre-existing humanitarian response plan, which already had a coordinated SRH approach with partners already operating in clusters in collaboration with the state government. However, we have an ongoing advocacy to gather collective support for the implementation of the recommendations of the MRA, which was conducted in 2023, like you mentioned. And so the existence of a response plan, and then having done a recent MRA that has results that is looking for opportunity to be implemented, we had these two coalescing together to help us move faster. But we need to also understand a key constraint that concerning Nigeria, a key context that would give you more information on why it needs to ride on something else to move. Nigeria operates a federal system of government with a three-tier governance system. That's the federal, the state, and the local government. This structure was intended to enhance reach at the grassroots for equitable development. However, in reality, this isn't the case. Issues prioritized by the federal government are not necessarily binding on the states and local governments, as they also have autonomy to determine their priorities. This has made it necessary for us to now get a buy-in at state level, at local government level, through advocacies and sensitization to ensure adequate buy-in at those levels. And the flood response provided that opportunity, and that was, we were able to ride on it through SRH partners. And some of the issues were now integrated into the flood response plan and were delivered in Borno State. There were states that do not have this response plan, and so we saw that for them, sometimes even when there is a flood like that, the response wasn't as fast as we had in Borno State. And when we have that, you may have some avoidable casualties before partners now move in or government takes the lead in SRH in those areas. We also have, for instance, states that are better off in the flood response. They created those camps early, and SRH partners were able to move in a good time.
Yeah, thank you. Thank you very much. I mean, it's interesting to hear from that experience now and to see that actually the MISP readiness assessment, at least even if the links directly are difficult to see now, I think it's interesting to see that it actually created a bit more traction around the SRH. I'm conscious of time. If you can just very briefly, Dr. Matthew, how are you planning in Nigeria to take the MRA now forward to the next step? What are you planning? How are you going to take this action plan forward? If you can just briefly share this with us.
All right. We have actually structured the action plan into priority levels. We have P1 to P4. And so there is a lot of focus on P1, P1 being the most prioritized, P4 being the least prioritized. And we are currently moving with some of the P1 issues, which includes capacity building, putting SRH supplies in place, local procurement, and also getting governments to take leadership in most of these areas, policy and implementation guidelines. Also, government ownership is being prioritized a lot as one of the key interventions that we are moving on with from that. And then we have also seen that we are riding on the SRH partners that are already in the Northeast. Already, this has been introduced to them, and they have bought in fully. And they are also moving to ensure that they support the government to implement, while also prioritizing it in their own interventions that will be delivered in partnership with government. So these are some key areas of commitment that we have structured and prioritized from the reports of the MISP readiness assessment we conducted.
Thank you. Thank you so much. I think ownership is a very important element. So we have only a few minutes left in this webinar. So before I hand it over for some very short closing remarks, I would like to thank our 3 doctors actually that we had today. So thank you, Luna. Thank you, Matthew. Thank you, Michael, for the time and for all these very valuable insights that you shared with us. For the participants, don't hesitate. We don't have time for Q&A, but you can always send us your questions. Happy to follow up on these. So really, thank you very much for all these insights. And let me hand it over to Ashley Wolfington. She's the Deputy Project Director for FP and Reproductive Health at Propel Adapt. For some closing remarks. Sorry, I don't give you much time, Ashley. Thanks.
That's okay. We'll make it work, Nesreen. Thank you, Nesreen, and thank you to our esteemed panelists. On behalf of Propel Adapt, I just want to thank FP 2030 and Momentum Integrated Health Resilience for partnering with us on this webinar series. Just as Sarah mentioned at the outset, this is part of a series of 5 webinars that we'll be conducting over the next year in the lead up to the International Conference on Family Planning, looking at different dimensions of how we can ensure sexual and reproductive health, preparedness, emergency preparedness and response. And so we've looked already at FP 2030 commitments and how they're prioritizing emergency preparedness and response. 75% of countries have made a commitment that includes EPR, which is exciting. Today we looked at MISP readiness assessments and how they're a really powerful tool for planning and action and to build momentum and government support for SRH preparedness. We will be conducting a 3rd in our webinar series in the beginning of 2025, looking at some new tools and resources that countries and organizations can use to support SRH preparedness and response. So look out for more information on that soon. As mentioned, all of the organizations here, all 3 co-sponsors of today's webinar, will have the recording for this and the previous webinar up on our websites. And feel free to reach out to any of us for any additional questions or clarifications on anything you learned either in today's webinar or the previous one. And thank you again to our amazing panelists. And we'll see you next time. Thanks, everyone.
Thank you.